This is Radio Health Journal. I'm Reed Pence. This week, therapy chickens and horses and llamas, how animals are making themselves at home in nursing homes.
We really, truly believe in the healing power of animals. They can heal your body and your soul at the same time.
The Healing Menagerie, when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
We had a number of them that took from 6 to 10 days.
Why is it so historically difficult for Native Americans to vote? Then,
I got up, got my kids ready to get on a computer and had work to do myself, and there's just not enough time in the day.
Our prayers with the people who are parents this year. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Nursing homes typically have a variety of activities available for residents. What those activities are varies tremendously, and some are truly inventive. For example, at the Life Care Center of Neshoba Valley near Boston, therapy chickens have made themselves at home, and you may see a llama walking the halls.
Our llama, Travis, is kind of a rock star in the building. He is so even-tempered and wonderful. He'll come in the building and walk through the halls and interact with the residents. Their faces light up when they look out and see Travis in their doorway.
That's Lauren Gaffney, an occupational therapist and program director of the Memory Support Unit at Life Care.
He seems to know the people that need a little more attention. With the pandemic, we've been doing window visits. We'll take them around to the windows and, knock, and they'll come and reach out to him to the window, and it's a nice way of interacting even in such a difficult time.
Gaffney says Life Care has had llamas for about 15 years on its 40-acre campus. In the past, they've had chickens and goats, and 2 mini horses are still in residence.
We are able to bring them in the building. They are comfortable enough to go right into resident rooms. We had a gentleman that was here that are bringing the minis in to see him just made him so happy. He was very confused, but he knew that this was something that gave him joy. So they come in the building and interact with the residents, and it's pretty gratifying to be the person that gets to do that gets to have those interactions and the happiness, spreading happiness throughout the building. And we've also always been encouraged to bring our well-behaved dogs to work. We had a former director that had 2 golden retrievers that would come. I had a greyhound that would come and be on the memory support unit. So we really, truly believe in the healing power of animals. They can heal your body and your soul at the same time.
Many nursing homes have therapy dogs come in for visits from time to time, but llamas and horses are a whole nother level. Gaffney says they live at the facility and, at least before the pandemic, were able to come inside with a staffer just about any time, so they become much more a part of the family.
It's been wonderfully therapeutic for our residents that live here because it gives them something that's their own. We make it known that these are not the facility's animals. They're all of our animals. So on any given day when there isn't a pandemic, unfortunately, we would have families out there visiting with the animals, saying hello. It's a great invitation to have your whole family come and visit their loved one because there's a lot to do and a lot of conversations to be had among animals.
Different animals bring different attributes. Life Care Center doesn't have chickens right now, as their original flock got too old. But Gaffney says they may be looking for new ones come spring.
Our chickens were hand-raised, so they were very comfortable with people, and it's actually really calming to sit and stroke a chicken. If the chicken will sit in your lap, it's actually oddly calming to pat the chickens. The other thing we found is we had their chicken coop right outside the window of the day room for our unit. So our residents were able, we called it chicken TV, were able to watch them coming in and coming out of their coop, and we had a large fenced-in area, and they were able to watch them kind of scratch for insects and do their thing. So it does sound like it's crazy, but it is actually oddly calming to pet a chicken.
Gaffney says the animals can help out even in relatively simple therapy.
As an occupational therapist, there are some things that we ask people to do that can be very scary if they've had a fall, like weight shifting or things like that, where we're asking someone to sit forward. If we're just asking for the movement, it can be scary. But if we say, gosh, can you lean forward and pat this dog? Or if you have someone that needs to stand, can you stand and pat this llama or brush this mini horse? All sorts of things that might be scary. You might be, a lot of times if you're here for rehabilitation, you're not at home, you're out of sorts, and just seeing an animal come through, it just really makes your day and kind of adds a little brightness into what can be kind of a tough time.
But it's in memory care where llamas and chickens and horses seem to shine brightest. For example, Life Care has a far lower usage of antipsychotic drugs than other nursing homes with a high number of dementia patients.
There's something on a very base level that we will have residents that don't have much vocalization abilities left. When you bring an animal over, whether it's a dog, whether it's the minis or the llama, we can get spontaneous speech that's incredible, full sentences, saying, I love my llama, isn't he beautiful? I have a really touching moment with a woman who is very down and depressed, and when we would bring the mini horses to her, she would pat him and one of our two whiskers, and she'd say, isn't he beautiful? Can you whinny for me? I love you. And it just was incredible.
Gaffney says animals even have benefits for workers, especially now amid the COVID-19 pandemic.
We have a path that goes all the way up around our llamas and the mini horses, and it's been recently a very stressful time, and it's been so therapeutic to just take a moment and take a walk around to see what the animals are doing, to interact with the animals, to pat the animals. It's beneficial on many different levels. Some of them we didn't even think of when we initially got the animals.
Other elder care facilities have reached out to Life Care to find out what it takes to start up their own therapy animal programs. Gaffney says it's a lot of work. More than anything else, it takes commitment.
Just like anything else, it's important to have people that understand the animals, understand the health of the animals. Having too many horses is not easy. It is a lot of work. There's 3 of us that care for the horses. Horses, you don't take a vacation from their needs. Every day we muck out the stalls. They're fed, they're watered several times a day. It's a large commitment. It is not something that you can proceed in lightly. So more than anything, there's major commitments because you are taking on a commitment for the life of this animal, but also making that commitment to your residents because you are committing to something that's going to provide a lot of happiness and mental wellness. But it is a lot of work. But in the end, it is more worth it than you can even imagine.
However, not every nursing home can even consider having a menagerie in residence. Life Care of Neshoba Valley is on a 40-acre site. Most other facilities don't have that kind of room.
They may not be able to have llamas or mini horses, but there's facilities that have rabbits or chickens or anything that you can have that a resident can hold and pat and take care of is really beneficial. And the fact that they live here, it's always good to have a dog that comes in and visits, but they go home if they're just a short term. Having the animals at your facility so the residents can feel a sense of partnership with those animals really creates moments and experiences for your residents and the people that are here that actually make a huge difference in their life and make it so much better.
And if you're bringing the animals inside, you have to ask, how hard is it to house train a llama?
Actually, we have never had an issue with the llamas. They're much like cats. They like to go to the bathroom in the same areas, so they're actually quite stable for us to bring inside, and that thankfully is not something we have to worry about. We did have several goats that are not house trained, and it was a little crazy, and that just did not work out for the interactions with the residents. But the llamas have just been such an amazing piece of the family here.
And it seems that family is an important concept. Just as people who own a dog live longer than those who don't and recover better from events like a heart attack, nursing home residents with a llama or a mini horse in the family seem to do better too. And when a resident's family visits, it makes the day uplifting.
The kids come and they're so excited. And like I had mentioned, we make sure that our residents know that they're all of our animals, so they get to take their grandchildren running up to see their horses. And the look of pride and happiness that's on the faces of our residents when they have something so valuable and so interesting and so exciting for their grandchildren and children, and they're able to share such a wonderful bonding experience together, it is really quite wonderful to see. And you can see that for a moment, it takes them out of the role of someone in a nursing home. They become just a family again, and they're all enjoying an experience together.
You can find out more about all of our guests through our website, radiohealthjournal.org. I'm Reed Pence.
Multiple sclerosis affects an estimated 1 million adults in the U.S. alone. In multiple sclerosis, the immune system mistakenly attacks the central nervous system, affecting a person's muscle control, balance, vision, sensation, and cognitive function. Though the exact causes are unknown, Epstein-Barr virus, a very common virus which causes mononucleosis, is the only risk factor identified to date that appears to be necessary for the development of MS. An investigational therapy called ATA188 specifically recognizes Epstein-Barr virus infected B cells. It is currently being studied in a clinical trial, which is now seeking participants. If you or someone you know is living with progressive MS and is interested in participating in the ATA188 clinical trial, please email patientadvocacy@atarabio.com to learn more and find a trial site in your area. That's patientadvocacy@atarabio.com.
A message from Greenstone, a Pfizer company. Most of us know about generic medications, drugs that work in the same way and provide the same clinical benefit as brand name medications, often at a lower price. Most generics are made by a different manufacturer than the original brand, but there is also a lesser-known category of generic medications called authorized generics that are made by the same manufacturer of the brand name drug. Authorized generics, like all generics, meet FDA quality and manufacturing standards. Authorized generics are the same as the brand name drug and only differ in that they do not have the brand name on their labels and may have a different marking on the medication. In limited cases, they may have a different color. Authorized generics are not new. Greenstone has been supplying authorized generics for over 25 years. Talk to your pharmacist or visit greenstonegenerics.com to learn more and see if they manufacture an authorized generic version of the medication you take.
As many as 89% of hospitalized COVID-19 patients are at risk of a complication called cytokine storm, a leading cause of COVID death. But there's good news. Hospitals across the U.S. are enrolling patients in a trial evaluating lemzilumab, a treatment candidate designed specifically to stop this storm, even with only 1 day of treatment. Dr. Cameron Durant, CEO of Humanigen, the company developing lemzilumab.
Having a therapeutic that can significantly reduce the time to recovery from COVID-19 and send patients home earlier could dramatically impact the arc of this pandemic.
Participating in the study means access to a potential treatment option in addition to standard of care therapies. Trial participant Mark Baranski shares his experience.
I don't know if I received lemzilumab or not, but I viewed the trial as doing everything I could for my recovery while contributing to the fight against COVID-19. I certainly encourage others to do the same.
To learn more and find this trial near you, visit StopStorm.com. That's StopStorm.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Time is going to just slap you around because you're not able to anticipate what's coming at you and get ready for it. And it leads to a life of crisis after crisis after crisis.
Time blindness. People who are always late and simply can't perceive the passage of time.
Then what does the hand you use have to do with what makes you, you?
I do think it's a little bit of my identity. I have to say, when I meet somebody and they say that they're left-handed, there's some type of bond or kinship.
All that and more on Radio Health Journal.